have Dr. Sarah Ho, Hospital Authority Chief Manager. First, Dr. Choi will say a few words. Today, we have two new confirmed cases, and they are local cases. There's also one imported case. So in total, there are 3 new confirmed cases. As at today, there is a total of 1,051 cases. Now, after 22 days, we had no locally infected cases, and today we have the first. So we are very much concerned about it. The Department of Health is now carrying out epidemiological investigation and contact tracing. Now, given there is still limited knowledge about the COVID-19 around the world, but overseas and local experts have forewarned that this would be a drawn-out battle, so we have to be prepared for that. And there will be various, fluctuations. There may be sporadic cases or community outbreak, like what we saw in Seoul. And so this is unavoidable. So that's why we must remain vigilant. We must not let down our guard. We must take all necessary precautionary measures. We must observe personal and environmental hygiene. So it is crucial that we do our best to prevent the spread of the disease in the community. Now, at the personal level, we need to protect ourselves. So when you have any symptoms of respiratory diseases, or when you take public transport or in crowded places, you must wear a mask. You must also keep your hands clean all the time, especially before you touch your mouth and nose. At home, the public should keep drainage systems clear. And for all drain outlets, if you don't need to use them, please cover them up. And also, you should put down the toilet policy cover before you flush. This is to prevent the spread of the disease. On social distancing, the government must continue to adopt the suppress and lift strategy. On the public health, the economy, and the day-to-day activities, we need to strike the right balance, and we need to keep adjusting our strategies and decide on future social distancing measures to lower the risk of transmission. We have been most cautious in suppressing or lifting social distancing measures. At this point, the government believes there is no need to go back to the more stringent measures in March. That means on the 8th of March, we have updated certain instructions on social contacts, and those instructions remain valid. Of course, we will monitor closely the developments of the epidemic, and will make adjustments as necessary in a timely manner. Now, on stepping up testing. Now, if anyone displays symptoms related to COVID-19, such as a fever or respiratory tract symptoms, even if they're mild, please don't overlook them. Please go and see a doctor as soon as possible and take a test, so we are able to achieve early identification, early isolation, and early treatment, which are our objectives. Now, members of the public could go to a general outpatient clinic or to a private hospital or private practitioners. You can ask for a test. And we are going to step up testing on those without symptoms. First, we're going to strengthen community surveillance. So for the high-risk groups, they will be covered. For example, staff working at the airport or homes for the elderly. That's the first thing. Second thing, on the 20th of May, or from the 20th of May, for patients in in psychiatric wards, even if they don't display symptoms, they will be tested. We will continue to monitor the development of the epidemic, and we'll listen to the advice of experts. We also have regard to the actual situation in Hong Kong. We will not hesitate to take new necessary measures. Here, I would like to make an appeal to the public. Please remain vigilant. This is going to be a drawn-out epidemic, and there will be fluctuations. So we must work together to fight the epidemic. We ask you for your patience, and thank you for that too. Thank you. Dr. Chuang, yes, there are 3 cases, 1049 to 1051. For 1049, a 66-year-old housewife. On the 8th of May, she started to have a fever. It was a Friday. And then on Saturdays and Sundays, she stayed at home to rest. On Monday, she went to Mrs. Wu Yu Clinic to see the doctor, and she got a specimen bottle. And then on the 12th of May, Tuesday, she returned the bottle. In the evening, we learned of the result, and she tested positive. She lives with her family in Block 5, Lei Mok Shu Estate. During the day, usually she'll go to the market in the morning, and she would be wearing a mask, and then she would go to her son's home to take care of her granddaughter. The son lives at Chek Ming House, number 10 Chuen Wan Market Street. Other than that, she doesn't have other activities in her family. There are in total 8 family members on the 2 places. That is her husband, daughter, son, granddaughter, and so on. And last night when we approached them, we found 4 of them were displaying certain mild symptoms, such as a cough or a low fever. So they've been arranged to go to hospital. For the rest of the family members, they've been sent to the quarantine center. And then in the course, we found that 3 others also had a mild fever, so they were all sent to hospital as well. And there's a close contact who was sent to the quarantine center. So for the 8 close contacts, 7 were sent to hospital. We've done some tests. And for the preliminary test results, one of the actually, she's got only just 1 granddaughter, aged 5. She's already a confirmed case. She's tested positive. So she's case number 1050, case number 1050. And for the other 6 family members or close contacts, so far the test result is negative. Now, for the activities, this lady carried out, she didn't do much. She just went between the 2 homes, and she went to the market to buy fresh food, that's all. Now, it's been some time since we had a locally infected case, and we know, of course, the public are very much concerned about it. So we would like to take this opportunity to try to expand the scope of laboratory surveillance. So for residents living in the 2 affected buildings, we will try to give them the specimen, deep throat saliva specimen bottle, and then they could return the bottles to us for testing. Now, we're not saying that residents living in the same building could be infected. We're just saying that we want to find out more. And she's been to certain vegetable store or meat store. Well, she was able to tell us which store she went to in the market. And so we'll also arrange for a deep throat saliva test for workers at these stores, and we'll try to trace the source of the infection. For case 1050, a 5-year-old girl, that's the granddaughter of case number 1049. On the 11th of May, she started to have a bit of a cough. She lives at Chek Ming House, number 10 Chuen Wan Market Street. She's home most of the time, and she might usually go to tutorial school, say on Saturday. On the 2nd and the 9th of May, she went to a tutorial school in Chuen Wan, and usually there was just 1 teacher and another student. Everyone wore a mask, so they shouldn't be close contacts. But because this is a local case, we want to expand the scope of testing. So for people working at the tutorial schools and students who went to the preparatory school at that time, we would arrange a deep throat saliva test for them. And then on the 9th of May, she went to her grandmother's place for dinner. There were 10 plus persons present. The grandmother lives in Block 8 Tai Kwok Choi Prosperity Garden. Now, her grandmother became unwell starting from the 8th of May. So on the 9th and 10th of May, this girl stayed with the maternal grandmother. And the maternal grandmother is therefore considered, and the others living in that unit are considered close contacts, so they will be sent into quarantine. And then case 1051 is a male gentleman, age 34, from the 12th of March to the 8th of May, he went to Pakistan to visit his family member. He went on his own. His family members didn't show any symptoms, and he was not in contact with confirmed patients. And then on the 8th of May, he went through Qatar Airline, taking flight number QR818 to come back to Hong Kong. At the airport, he left behind a deep throat saliva sample. At the time, he tested the negative, so he was sent to quarantine center. On the 12th of May, he had a fever, so he was sent to the Queen Elizabeth Hospital. Today, he tested positive. At the quarantine center, he was staying on his own, so he has no close contact. Now, for these two local cases, so that warrants a reminder for the public. That is for COVID-19 cases that could be mild or even no symptoms. So that's why we must remain vigilant. If you show any symptoms, you must go and see a doctor as soon as possible, so a test can be done as soon as possible. We would also write to private doctors today. That is for patients showing mild symptoms or related symptoms. The private doctors should arrange for them to take this free test. Starting from this week or this Friday, we're going to further expand the laboratory surveillance scheme. For workers at the Hong Kong International Airport, they will be given free COVID-19 tests. For airport workers, of course, they come into contact more frequently with high-risk travelers because there could be travelers coming back from high-risk areas. So therefore, we would like to step up surveillance on this group. So by doing tests, we're able to identify probable cases early, and that would help to reduce the risk of community transmission or outbreak. We're going to set up service stations at a specified location. There will be a quota, say about 500 places per day. And we'll provide specimens bottles to workers, and then they will follow the instructions and collect their own deep throat saliva samples, and then they could return the bottles to the specified location. We're also looking at ways to cover workers of homes for the elderly and the disabled. And so if they have mild symptoms, then we're able to do the test earlier for them. But we're still working on the details. That's all by way of report. Thank you.
Dr. Ho, please. Yes, good afternoon. By noon today, in the past 24 hours, Hospital Authority had 26 cases. Together with those who are in the hospital, there are total 65 patients undergoing treatment and receiving isolation treatment at hospital. In the past 25 hours, there are 17 patients that have been discharged after recovery. So far, 1,007 confirmed patients and 1 suspected patient have been discharged after recovery. By noon today, 36 confirmed patients in our 11 public hospitals are receiving treatment. Of them, 1 is in critical condition. It is number 595. And 3 other patients are in serious condition. They are number 338, 461, and 713. The remaining 32 patients, they're in stable condition. By the morning of today, 9 a.m., the number of wards is there are 1,251 beds available in 671 beds. Usage rate of 39% and 54%. There are two things I'd like to report back to you. First is that of the expanded surveillance area in the public hospitals, they will tie in with the government's strategy to control the epidemic. We will enhance the surveillance and testing of the virus. Since yesterday, we have expanded the surveillance scope. Besides patients with fever and related symptoms, from yesterday, we have expanded the surveillance scope to patients who are in hospital who have symptoms. They would take samples from the nose for testing. And also the scope of testing is mentioned for those who are living in homes, including elderly people or disabled people living in homes, particular homes, and also those in psychiatric hospitals. If they can leave the deep throat saliva sample, we will, at the time of admission into hospitals, arrange for their testing of the saliva sample. Because for this particular batch of patients, we are worried since they are high-risk group. And when we arrange for the admission into hospital for testing, the purpose is to have an early detection of the situation. And if there are confirmed cases, we can activate early the public health measures so as to reduce the chance of outbreak within care homes or dedicated homes. We understand that the epidemic may not be totally gone within a short period of time, so we hope that every one of you would not take it casually. And I'd like to report to you as well, in the North Hospital, in the isolation wards there, we received reports that last night at 11:30 at night, there was a single isolation ward where a switch actually to the gate switch was not stable, and the situation lasted for 3 minutes. And we asked the electrical mechanical engineering department staff to come for to take an investigation, and it had not had any impact on the negative pressure system in the ward. And the single ward, there was a patient who needs to have a vaporization procedure. And it's an isolated patient, but it's not a patient confirmed with the coronavirus. And this is for the isolation ward in Northern Hospital, the third time when an incident happened in relation to the negative pressure ward. And the single person ward now has been clear of patient. And we've asked the maintenance party, the electrical mechanical engineering department, to have a thorough investigation of the system. And when the investigation report is done, it should be submitted to us ASAP so as to avoid repeat of the same incident. So that's the end of my report. So now it's time for Q&A. So please, before you ask a question, please tell us the media organization you're from. This lady, please. I'm from Cable. I want to ask about the 66-year-old woman. What's the source of her infection? Have you found it? And also, in the past 14 days, has she been in contact with anyone? And who were they? Would those people be required to go to a quarantine center? But you talked to her neighbors, and they said that the woman sometimes did not wear a mask. Is that true? And also, on Mother's Day, did she go out at all to a restaurant or public area for meals? And also, Professor said that Professor Yun said the testing capacity now done is too small. There should be 7,500 tests done per day. The rule on the 28 days without local cases, he said that it could be eased to 14 days as line to be drawn to decide on the next stage of development. And now we've got 2 local confirmed cases. Do you think that we can further ease restrictions on keeping social distance? The 66-year-old, that is 1049 case, we're still investigating the source of infection. It's unknown now what the source is. She had not been overseas, neither had her family members, and she had not had contact with any confirmed cases. But we are expanding the checking and to see whether people around her or around her granddaughter, even though if they were not their close contacts, whether they had been confirmed cases. So we'll try our best to see, find out what really happened, including investigating on people who were not classified as close contacts with them, including people who live in the blocks, residential blocks, and we'll have to find whether there are some hidden carriers in the community. Now that we've got 2 local confirmed cases, that shows that in the community there's a source of infection in existence. And because this particular disease may not have any syndromes, so there could be transmission of the virus by people without any symptoms. So we need to expand the surveillance scope. The 14 days, well, in the past 14 days, all the people in close contact with her, including her 8 family members, would be quarantined. And 1 of them have been confirmed, and 6 others are now receiving treatment at hospital. Once they are discharged, they will be sent to quarantine center. Her husband is already in the quarantine center. As far as we know, she did wear a mask when she's outside. I don't know whether the neighbor you talked to really knew whether that person was her. And on May 6th, she was not unwell, so May 9th and 10th, she stayed home and did not spend time with her granddaughter. That's why her granddaughter lived with her own grandmother. So she didn't go to any dinners or celebrations for Mother's Day. The testing figures, of course, we need to see whether there's a need for it. Many people have come back to Hong Kong. Well, for those who have come to Hong Kong from abroad, they will be tested. And now number of visitors have come down, so we've done fewer, or there are less testing figures. So we'll see how many more we need to test. And so now we'll call on private doctors today to do more testing of samples. We do welcome them, for patients with mild symptoms, to carry out tests on those patients. We also see whether we can do more testing at the airport, particularly targeting to high-risk groups. It's impossible to, with a population of 7 million people, to have random testing of anyone. For the case of 1049, we'll see what happens in the community. And therefore, the residential blocks that she lived in, people living in her neighborhood, they may be worried. And so we'll carry out a one-off test to see what the situation is within her neighborhood and the community there. Generally speaking, what do you mean that we have stopped the spread of local infection? Well, normally 2 incubation periods is the basis, so it's 28 days. If you add a few more days to that, assuming people see Dr. late, so now we've seen about 20 days before we have any local infections.
Next, please. The one in stripes, please. I'm from RTHK. Professor Yin Kwok Yung said that too few tests are done every day. It is ideal to have 7,500 tests every day. So would you take into account his view and then increase the number of samples for testing? And then would you set up testing station at Lei Mok Shu Estate and ask people nearby to take the test? Or would you do like what the mainland's doing, to do a major community random checks? Now, we are just less than 2 weeks away from class resumption. But if we have local infection with unknown sources, should we still proceed with class resumption? And the question for Mr. Chuang, for Dr. Chuang, is that since we have infection with unknown sources, that means there is a high risk of community outbreak, and which we'll be seeing more cases as a result of this case. We heard from the public that there are many probable cases going to Sha Tin Hospital. Is it true? Well, when we test samples, we'll look at the needs of the community. If there are many samples given to us by the community, say from the hospital authority or private practitioners, we will do the test. We never turn down any samples. As for proactive move, we are now testing all travelers arriving at the Hong Kong International Airport. They will have to wait for the test results before they can go home. And then we are stepping up that effort. Airport workers are considered high risk, so we will see how we could also step up testing for them. And we'll take this opportunity to arrange for testing for residents in the 2 blocks related to case number 1049. We'll see how we can collect deep throat saliva samples from these residents, because that may give an idea of the community situation. So we hope the residents will cooperate and return the specimen bottles to us. Now, is that a community outbreak? Well, there are 2 local cases. Even though they're related cases, that means there is an invisible transmission chain in the community, because we haven't been able to identify the source. So we don't rule out possibilities of more cases or even an outbreak. Of course, we don't want to see that. That's why we are now doing tests for people, around the patient and Sha Tin Hospital. Well, we haven't received such a report so far. But then for Sha Tin Hospital, it doesn't have an accident and an emergency ward. If patients need to seek treatment, they can go to our accident and emergency wards, and then doctors will do the relevant checks and treatment based on the patient's condition. Well, a question was on class resumption. Now, since the start of the epidemic, the government has been looking at a public health issue, the control of the epidemic. At the same time, the government has to consider many livelihood issues. Now, students have to go to school. That's an important matter as well. So as the epidemic eased, the relevant bureau had considered whether it's about time for class to resume. And on those occasions, the Bureau has explained the factors to consider. They will also seek the views of the Department of Health. And then schools have to make arrangement in preparation for class resumption. And the Bureau has to make sure schools make proper arrangement. And there is also a phased approach, so secondary school students, primary school students, or even younger students will resume class in different phases. Now, after 20-odd days, now we have a new local infection case. So the government will continue to monitor very closely the development of the epidemic, and then we'll see if there's need to adjust our policies. Thank you. Yes, the lady in spectacles. I'm from Singtao. First, about the case. In the housing estate, were there any travelers from overseas undergoing home quarantine? Because it could be a case with a longer incubation period, and that's why it's led to this community infection. Is that possible? And another question is on the testing figures. Do you think the current figure is about right? Do you think the public are taking enough initiative to do the test, and do you have any target? Now, you talk about airport workers. Are you going to do tests regularly for them, say once every 14 days, or how are you going to do it? Now, for gathering ban measures, you said there's no need to tighten up the measures, but would you set certain criteria as to when you might tighten up the measures? And there's talk about relaxing the boundary crossing. So we still proceed with the mutual recognition of health checks and what about class resumption? Will that proceed? Now, we see there's infection at probably at the tutorial school. So would there be tests for students regularly? Finally, on the North District Hospital, it's the third time there's a problem with the negative pressure system. Would you consider stopping the use of those facilities altogether for the time being? For home confinees in Lei Mok Shu Estate, yes, I believe there would be such cases, but then so far there's not a confirmed case at Lei Mok Shu Estate. So what we're going to do is to do the deep throat saliva test for residents living in the same building, and we'll see if we could identify other cases. So far, we're not aware of other cases. Now, we don't have so-called ideal testing figure in mind because the tests have to be done for a purpose. If, say, anyone in Hong Kong shows mild symptoms or related symptoms, we hope they would do the test. And if doctors come across such patients, we hope they will also do the test so then we could identify infected cases. For people without symptoms, of course, this would be more complicated. You can't expect all 7 million people in Hong Kong to undergo the test because how often do we do it? For the airport, we're just trying out doing tests for all workers there. We'll do it once first because there are some 30,000 people working at the airport. So we will be testing them in batches. And after the first test, will we do it regularly? Well, then we'll have to see whether anyone would test positive. If no one tests positive, then there may not be a need for regular tests. On various government measures to fight the epidemic. Well, you mentioned 2 points. One is the gathering ban regulation. Well, 3 or 4 weeks ago, such measures were launched because at the time the epidemic was more serious, so it was necessary to enact legislation or regulations to reduce social contact. So it really depends on the epidemic, and we don't just look at the case number for a day. We look at the trend as well. We've explained that before. We'll see whether there's a sudden spike in numbers, whether there is a major community outbreak, and whether there are signs of extend the spread of the disease in the community. And then we'll have to see what testing measures we have in place. So it's a basket of factors. On the gathering ban regulation, on the 8th of May, we announced minor relaxation. So the gathering size is now 8 persons instead of 4. And we made the decision having considered all the factors, including the number of confirmed cases, the trend, and the public expectation or acceptability and the impact on people's livelihood and so on. So these, as a result, then we came up to that decision. Now we know there's a new there are no new infected cases, but we will watch the trend and we will make an adjustment as appropriate. On now, if there's easing of the epidemic, then do we need to make relevant, corresponding adjustment to our measures? Well, there are certain, commercial needs or there are livelihood issues, and people may need to go to other cities. As a result, we are still in discussion with the relevant authorities if there is a need to make such adjustment. We'll have to see what details we have to consider, and we're still discussing that. At an appropriate time, we'll make an announcement. For the relevant ward in the North District Hospital, we have stopped using that particular ward. And we've also asked the Electrical and Mechanical Services Department to do a thorough check on the system. So far, at the North District Hospital, we only have one confirmed case, and that patient lives in another ward. And in that other ward, the negative pressure system has been working fine. There's been no problem. Next, please.
Commercial radio. Just like to ask you about the case 1050, the 5-year-old grandchild. She went to a tutorial center. So between the student and the tutor, what is the distance between them when they're having lesson? Have you found out about how they conduct the class? And also, there are clusters in the past which have been because of communal facilities. So the toilets in the tutorial center, would you consider that a high risk, and to collect environmental samples there from the center? And also, I'd like to ask Undersecretary Choi. Well, there used to be electronic wristband that was used, and people did not give the true address after they passed through the Shenzhen Bay border checkpoint. And we only found out later that there are passengers who provided the wrong address. So is the electronic wristbands really effective in quarantining the people coming from outside Hong Kong? How many prosecutions have there been? And how many were prosecuted because of the violation of the rule in association with the wristbands? The tutorial center is that there will be one teacher wearing mask, spending 1 hour with 2 students. We have notified the tutorial center, and we will have disinfection across the center. All the community facilities, we hope that would be disinfected ASAP. And we have no plans to collect environmental samples there. As for people coming from the mainland or overseas, we have implemented the rule that they need to be quarantined at home or designated places by May 12th. For people arriving from outside of Hong Kong here, they would need to there are 7,500 orders issued for them to be quarantined at home. And also, for those who've been to the mainland, there are more than 10,000 quarantine orders. Under the 2 systems, these people involved actually are given the electronic wristbands. So we're using technology to carry out surveillance on these people, whether they've left their premises, whether they should be quarantined. I'll put it this way. In terms of enhancing our surveillance, one method is to have it done through reports. Therefore, our OGCIO early on had provided measures so that the public, when they see people wearing the wristbands who are away from the quarantine centers and moving around in the community, public can make reports on that to the police or call numbers, hotline, so we can get the information. And this measure is still in force. Of course, there are people who just, even worse, who might want to leave the border checkpoint. That's really undesirable. In the past, there were 4 people who had returned to Hong Kong from the mainland who tried to flee, and one was sentenced to a maximum 3-month jail sentence of 3 months or 4 weeks. Next one, this lady, please, in white. I'm from Economic Times. I'd like to ask about the home quarantine. based on the information you've had of all the confirmed cases, the latest 2 cases in the 2 blocks they lived in, how many people there were under quarantine? What are the chances of spreading the virus? And also I'd like to ask Dr. Choi, you announced today that the arrangements for school reopening will remain unchanged. And have you given any advice to the Education Bureau? And based on what reasons do you think that schools should be reopened as scheduled? And also I'd like to ask you about, just then you said that together the HA and the Center for Health Protection can do 2,000 to 3,000 testing the most a day. Does it mean that you can actually test up to 3,000 samples a day? What is the ceiling for testing on a daily basis? As for home quarantine order, I know that in the 2 blocks there were 3 people under home quarantine, but they were not confirmed cases. I also looked at the units. They are not vertical, in a vertical layout. So I don't think that there's any evidence to show that they are the source of the infection of the latest cases. But we arranged for people living in the blocks to provide deep throat saliva sample and to see if they're really the source of infection. And as for the community, the needs there, well, we will do testing for people with symptoms because the HA at the outpatient clinics, if there are many samples collected, and they will send them over to our laboratory. For private sectors, if they have collected more samples, then we also carry out laboratory tests on them. We will take the initiative ourselves to take samples of people arriving at the airport. At the airport, we will carry out the tests, and we will also distribute the second bottle. And that's what we've been doing. For the earlier round, where there were a lot more suspected cases or cases which required testing, within our public health laboratory, we managed to do 3,000 tests a day. That was during a peak time, but there's need not be a need for so many tests every day. As for school reopening, of course, we need to consider a number of factors. I told you just in the context that in the past 2-3 weeks, the epidemic has eased a bit, and so we thought that it's worth adjusting our policies, and therefore the Bureau concerned began to plan for school reopening. Of course, still, you need to consult the information on the epidemiology and figures related in the past 2-3 weeks. Basically, not every day we had a new case, and also we only have sporadic imported cases. And also it's only after more than 20 days when we have seen the latest confirmed cases. So that's the context of the epidemic so far. And also the characteristic of the virus is that either local overseas experts or health authorities are aware that this particular virus may only bring forth mild symptoms. For some infected people, they may not even show any symptoms at all. And thirdly, to prevent human to human transmission, it depends a lot on the public observing personal hygiene, wear masks, and wear masks properly. And also, when we consider school reopening, there needs to be adequate measures in support of the move in terms of personal protective equipment and also observing personal hygiene. And now, today, we've reported confirmed local cases, and the government would closely monitor the development and see whether we need to adjust the policies further.
So is it the case then your testing capacity is at most 3,000 something? Well, usually there's not a strong demand, so that's why the public health laboratory is only handling about 1,000 plus tests per day. But then during the peak, we could deploy more manpower and then we could do more tests. It depends on the needs, really. If there's a need, of course, we'll deploy more manpower and then we could handle more tests. Sorry, speaker's not coming through. Well, at the airport, that's why we're going to start doing some tests. The gentleman over there. There's a question of 7,000 plus or 3,000 plus tests. So do you have the capacity to handle 7,500 tests a day? It seems that your maximum capacity is only 3,000 plus. What about private hospitals? Are they doing enough? Should they do more? And then for the 8 close contacts in the Lei Mok Shu estate case, how are they related to the old lady? Who are actually staying with that old lady? How many of them? Now, on easing the quarantine measures and social distancing measures, experts have different views. Do you think you need to suppress, or could you lift those measures now? I think there is no magic figure as to how many tests we should do. Of course, with tests, the more the better. But then it really depends on the needs. We would like to work on people with mild symptoms. Or symptoms. Now, there are people with no or mild symptoms. If they may just stay home to rest and they don't go to a doctor. So we want to deal with those cases first. And if government or private doctors see such patients, it's hope that they will prescribe the test as far as possible. And then we also need to work on high-risk groups, but we have to do it a step at a time. If there are no symptoms, then is it worth doing the test? And is one test enough? And what do we do after the test? So we have to consider all these issues. I mentioned this old lady stays with the daughter, the son-in-law, her husband, and a grandchild. And every day she will also go to her son's home, who also lives in Tsuen Wan, to take care of the granddaughter. So that's why there are 8 close contacts in this case. On the trend of the epidemic and the various measures adopted by the government to fight the epidemic, well, it really depends on the characteristics of this virus. Now, there are many experts locally and overseas, and even the World Health Organization has stressed that because of the nature of this virus, there is an ongoing and a drawn-out impact on the world. And so given the nature of this virus, we may go into new normal. Maybe at different seasons, we'll see fewer cases, but at certain seasons, we'll see more cases until there is increased herd immunity, either through natural immunity or a vaccine. Then the situation may stabilize. So this is a known fact. So because this is the character of the virus, and so it's become a new normal that we have this epidemic, so we need to have this suppress and lift strategy. We can't be suppressing all the time and stop all activities. It's not practical because there are economic needs and there are livelihood issues that we have to consider. So the government has considered the development of the epidemic in the past 3 weeks, and it decided that we could relax certain of the measures. So we have to watch closely the trend of the epidemic to decide when we suppress and when we lift. Of course, more importantly, we need to have a mechanism. We will look at figures. We'll look at the trend on the mainland and in other places. We'll also look at the measures taken by other governments. And then we'll also look at our own suppress and lift measures to see how they impact on the epidemic. And then, of course, we'll also listen to the views of experts, and then we will make appropriate adjustments. Over there, please.
Okay. Firstly, on the new local cases, is it highly likely that the woman catch the virus in the 2 residential blocks that she often go to? And you said you plan to test the residents in the 2 blocks. How many of them are involved, and do you foresee that a local outbreak is forthcoming? And also, why do you think there's no need yet to do a citywide widespread virus testing? And for Dr. Choi, why would you say is not the time yet to tighten the anti-epidemic measures at the moment? Would you say the Hong Kong people has become relaxed in the recent few days in the fight against the epidemic? Thank you.
For the new local case 1049 and also 1050, they are family contacts. So we have quarantined all the close contacts in the quarantine center, and we will test them. But because it has been quite a while before we have a local case, so we try to take this opportunity to test the residents in the blocks where she stayed or lived during the incubation period and as well as the infectious period, to understand more about the local situation, because we want to take this opportunity to test more of the residents in the community, and in case there are some silent transmission that we can detect. I think the Lei Mok Shu estate, they have around 800 households, and for the other building is around 60. So for the Lei Mok Shu estate, we'll try to work with other relevant government departments or the management to see how we can distribute the bottles to them effectively. And for the other block, because the involved size is small, we'll try to distribute them to them by ourselves. So this result will indicate the situation in the local community. So it does not mean that the case acquired the disease from these two blocks, because she also has a little bit of community activities, because she traveled daily from Lei Mok Shu to Tsuen Wan through the minibus, and also she also visited some markets, and also her household contacts may also be a source. So we are also investigating the people's contacted with their household to see whether there are other possible sources. So we try to test all those people coming into contact with their household members to see whether we can find another case. But it is also possible we cannot find, just like the previous cases. Yeah.
How about the citywide?
We'll try to see the result of this testing first to get our way forward. Yeah.
Concerning all the government measures in reducing social contact, I think all the measures have been really quite tight in late April to early May, because of the development of the outbreak in, say, early April, which is the peak, so to speak. So in view of the development of the outbreak in mid to late April, in terms of not every day we have a reported case, and also mostly imported case, and only after more than 20 days we have another newly confirmed local case. Is in that context the government consider it might be an appropriate measure to relax a little bit, with also constraints to the previous very tight measures, including, for example, closing 11 types of scheduled premises. So we relaxed the number of people in, say, group gathering, and also reopen 7 scheduled premises with conditions. So all the considerations of relaxation or limited relaxation is based on epidemic data, and also views from the experts to the government. So I think with a new confirmed case for one day, we will observe very closely the trend and decide whether we need to adjust the measures accordingly. Thank you.
我哋答多兩位朋友問題，呢位黑色衫嗰位女士。
This lady in black from Mingpao. Dr. Zhe, 1049, 1050. How many close contacts that need to be investigated? And do they include the more than 10 people who had meals with the granddaughter? And also, are there any people who had developed symptoms earlier than them? And 1050, when she had the meal with more than 10 people, where did they have the meal? Besides going to tutorial center, did she go downstairs to play, or were she in contact with other children? And second question is about the amount of testing. Dr. Ho Pat Leung today said that HA's emergency units testing had come down in numbers. So does HA have any number on the amount of testing in the past month? Has the number of testing come down? What is the reason if they have come down? And how are you going to enhance or ramp up testing in the days ahead? And third question, about Dr. Cheung saying that in Lei Mok Shu Estate, three people were in home quarantine. Are they still under quarantine, or had they finished quarantine already? Do you know, have anyone have violated the quarantine order and had left the estate and gone outside? 1049, as I said, she had 8 close contacts. One of them was case 1050. For case 1050, her close contacts included people who lived in her grandmother's house and also had meals together. There are about 10 of them. For the exact figure, I need to look at it again. For places she went to included the tutorial centers, and also on May 10th, she went with her mom to Olympic City, a restaurant there for meal. Just she and her mother alone. As for home quarantine, I think there were 2 in Block 5, 1 in Chetling House. They are still under home quarantine now. They're still having the home quarantine. As for the HA's testing, we actually did it depending on the clinical needs of the patients. As for to ramp up testing, just then at the start of the press briefing, I mentioned that yesterday we began to expand the scope of testing. That is for patients who have upper respiratory tract symptoms, infection symptoms, then we would do the testing for them. And also for, well, since yesterday, for patients who originally came from care homes or special homes, then if they can give us their deep throat saliva sample, we will also do testing for them. So we hope that for high-risk groups, we can ramp up testing for them to actually, should they have the virus infection, we can stem any outbreak in the particular homes. Normally, every week, we would do testing for 1,000 cases. At the peak, we did do 2,000 testing cases. It all depends on the patient's needs, and if they have sought help at our emergency clinic, or if they have were found to be suitable for testing after doctor's inspection, then we arranged for testing for them. This lady, Hong Kong 01. I would like to ask about what is the amount of testing in May on a daily basis, average daily testing amount, and you're going to accept the bottles from 2 blocks. For the 2 blocks, how many people are we talking about who will be having their sample tested? In Chetling House, there are sex workers there. Would you need to trace the customers of the sex workers? And are you confident that once you have given the residents the bottles, are you sure that they will return the bottles to you? And also you said that there are 3 people under home quarantine. And can you give me more breakdown of people under home quarantine in the blocks? And also, we've seen sporadic cases in the past months, so the deadline or the principle of 28 days may not make much or may not be very meaningful, because they may be sporadic cases. Then that means that there's no end to the gathering ban. Is it that the risk of suspending the gathering ban is higher than stopping school reopening? Well, for home quarantines, there are 2 in Block 5, 1 in Chapman House. To receive or to collect the samples from them is all on a voluntary basis because they had no symptoms. And also they are not close contacts. Even many of them were not even contacts, so we will not force them to undergo testing. But we know that some residents might be worried, so we have arranged for these people to go for testing and to let us know more about the situation of the community there. As for the testing figures, I think in the past few days, it's about 1,000, between 1,000 and 2,000 testing done in the past few days. Yes, HA and the Department of Health carry out testing in May every day. The testing volume is about 15,000 to 2,700. As for how the government considers when to tighten or relax the measures restricting social contacts, in end of April, when we first launched the tight measures, until the relaxation on May 8th, there's a period of some weeks, and we did not only consider the 28-day principle. We need to look at the overall trend. If the situation stabilized, then the government would need to strike a balance, right? Consider various factors. Public health, of course, public health risk is, of course, a priority, but we also need to consider the impact of the various measures on people's livelihood. Therefore, on May 8th, when we eased the measures, it's the result of consideration of various factors. And depending on the development of the epidemic, we'll make adjustments. That's the end of the press briefing. Thank you all.